many of them cannot sacrifice full salary for the whole year, but they want to enroll in AVT for specialization. So any thoughts on what may be possible for them? Jaspal, to tell you the truth, even I carry the same concern. I used to think that yes, I will be able to do this course, but during my career, I didn't get that opportunity to take up a full-time program in AVT. But at the same time, being at the National Institute, I had the opportunity to attend several short-term training programs that helped me to understand the AVT and the oral habilitation of these young children. So I can fully understand my fellow professionals' concern, but to tell you very clearly that, or you will all agree with me that we cannot learn swimming through distant mode. So it is the same case with PGDAVT Jaspal. AVT is, as you know it very clearly, that AVT is a skill-based activity for which hands-on training is very, very essential, to master the skills. And in our country, most of the distant education programs in teaching, training are on hold. And distant courses can give you a good knowledge, no doubt about it. But practical experience only, comes with the hands-on. So what I can suggest you at this juncture is, the organizations should come up and depute their, or sponsor their professionals or their rehab therapists, in a phased manner for this training and get empowered, so that not only the professional development will happen at their level, but it will also improve the quality of service that each organization is providing, and it will be a great support for the children with cochlear implant and their family. That's a great suggestion. Yeah, this part. This is my belief. This is what I just think, that the only a solution that we can draw right now. But this while with these recent developments in the IT, and particularly with the outbreak of this COVID-19, I'm strongly feel, and I am sensing it, that we need to come up with more innovative programs that that should meet the needs and demands of the country in these difficult times. So I feel that we have to work on rehabilitation or training, or maybe an online training programs in future. We can also explore the possibilities of having part-time programs in AVT without compromising the quality, or by ensuring, we can ensure that the hands-on practice should be given without losing the quality, during weekends or in the evenings. This is what Jaspal I can suggest at this juncture. Wow, that's great. It's great to hear that you're already thinking of different options to make the course widely accessible, even to the people who already have their hands full with the jobs. I'm sure this will be very much appreciated by all the clinicians, and you get the credit for that. This also brings me to my next question. Do you think the audiologists or speech pathologists also need to do a course in AVT? Jaspal, to tell you the truth, or like what I strongly believe, that everyone, including the caretaker who is dealing with the CI kids, should have the knowledge of it. So it's a holistic approach. See, you cannot leave anyone, behind, and then say that, we can achieve everything what is, we have said. So let me start with an analogy to explain you a little bit more on that. Imagine that if someone has a cancer, who would they consult? A doctor with an MBBS or a doctor with an MD oncology? Obviously, Jaspal, you will tell me that yes, second one, I will prefer to go for MD oncology, right? Yes. So why should it be any different in our profession? See, the bachelor's program in any discipline is And in order to excel, in any profession and to equip themselves to offer the quality services in for children with cochlear implants, it is always better to have a mastery in AVT, which can be achieved through add-on courses like a PGDAVT and PO2. And every speech and hearing professional, I feel, should consider, this achievement or this course, as a feather in their cap. And in such courses will empower their professional as well as the personal knowledge. Also, you look at the scenario of the number of professionals, speech and hearing professionals in the country. We have many, though we are not having the adequate number. But see, all these speech and hearing professionals are have a huge workload of conducting audiological assessment, audiological support, mapping, as well as the management of hearing speech and language disorders. We have very few professionals who have the time to focus on listening and spoken language therapy of children with autism. So, my hope is that, the course will fill the gap between the number of qualified professionals and the huge number of children with cochlear implants.
I absolutely agree with you, Dr. Matthew. That's true. We live in an era of specialization, and in any field, best practice can be obtained only by specializing in it. All of us want to provide best services as professionals, and for which such courses can be helpful. In fact, many senior professionals from the best of audiology institutes in the country are here, like Aish Mysore, Nish Trivandrum, Nish Bangalore, PGI Chandigarh, etc. Would you like to say anything to your colleagues from these institutions?
Wow, I'm very happy that all are joining in this webinar. Obviously, I'm very happy that all the lead institutions are here today. Sharing our thoughts and things like that. And all these representatives who are joining in this webinar will agree with me that we all work on the same principle, that is, never be late. We all focus on early diagnosis, treatment, and intervention, right? While appreciating the contributions of these institutions in the field of mainstreaming of deaf and hard of hearing children in the country, as well as supporting the AIIMCET program of the state or the central ministry, I request these institutions to come up with their own AVT training and therapy programs, because this will fill the gap between the number of professionals and the cochlear implant recipients that we need to serve. In the meantime, I recommend that this program to their students who are attending the training in special education or the speech and hearing area. See, internally, while preparing the calendar of activities for each program, whether it is bachelor's or master's in audiology or speech language pathology or B.Ed in special education or master's in special education, you can include a good orientation program on AVT as a co-curricular activity, so that the interested students can learn some basics and get motivated to pursue the AVT program. And Jaspal, I think most of us have traveled via Mumbai International Airport, and you might have seen the slogan, think globally and act locally. See, every state should run the course at their institutions to meet the local needs, but with global standards. Again, I repeat that. We should meet the local needs, but we should not compromise our global standards. Every professional should have an opportunity to get trained in AVT in their own state or the regional language, and every child with a CI should have the access to AVT training in their mother tongue.
That's true. I really love your message on think global and act local. Dr. Suni. It reminds me of a millennial term, glottal, which is a harmony of global
Think
and
global,
local.
act local.
I also echo your sentiments of training
ये
local
बढ़िया है।
professionals in AVT so that they can help the cochlear implant recipients
कौन वाला?
residing there.
इसको लिया
We
ना
also have several
Bye.
senior surgeons and ENT. Hats
ये
off
पछतावा
the
से कोई करेगा
Department of Government Medical Colleges and
महामना
government
करना चाहिए।
hospitals also. They are running big cochlear implant programs. Many of us work with them, and many of them are here with us today. What is your advice to them?
At the outset, I really thank all the ENT surgeons, joining this webinar, for taking out their time and listening to me. You all are very, very important, for us. And if you look at that, why I say why they are very important to our programs is that many of the ENT surgeons and the hospitals are empaneled with us under the AIIMCET program, and they have been wholeheartedly putting their support in implanting the children and supporting their post-habilitation activities. And once again, I thank you all for the unconditional support that they have given to sustain the Government of India's largest scheme for the young children, bringing positive outcomes in the CA recipients. And while compiling the success stories, as you can see in the slide, I came to know about this little Tatwa. Isn't it his smile so contagious, Jaspal?
Of course it is. Very cute smile.
Look at the energy that he has. I'm really amazed to see him. He got his first cochlear implant before the age of 2 years, and he was also coming to AIJ for the support. And today he is doing excellent. And Tatwa's success is a testament of early diagnosis and early intervention. And according to the Hart and Risley, that a child who is 4 years, when he goes to the regular school, has heard of 46 million words at that age. Wow.
That's a great number.
Look at that number, Jaspal, and think of our children. See, I can imagine the gap between our hearing impaired children and these hearing children. But I am very sure and confident that we can reduce this gap only through intervention. And if you look at the researches of Miss Yoshinaga Itano of Japan, and she has said that early identification. How early? She said she cannot define, because in every research what she has done, she has reduced that age, and so she said I cannot define early. How early means as early as on the first day of birth or before birth. So she said that can bring better outcomes in these children. So look at that, So we also to take up the lessons from these research findings and work hard to reduce this gap. So I urge all the ENT surgeons to support us and contribute by conducting the cochlear implant surgeries without any delay after confirmation of the candidacy for cochlear implant. And Jaspal, you look at the orthopedic departments in our country, many ensure that, they have the physiotherapy courses available in their same medical colleges. Of course. And also, ophthalmology departments have courses in optometry. So the ENT departments should also strive to start the AVT and other allied courses that will help them to augment the good surgical outcomes with equally robust speech and hearing outcomes. So that is what every parent wants, hopes, and also expect for their kids getting cochlear. I think Yeah. And additionally, if you look at it, it's always better to provide a holistic support under one roof. You see, it's very sad to see a mother with a 1-year-old baby running from pillar to post for the different services. So I strongly believe in offering a holistic support under one roof. So every person involved in this program, MCI program, should be equipped with all such services. Every hospital should have the post-implant, therapeutic services, just should associate with them, so that there should not be any problem with their services, and our professionals who are attached with your institution should also be empowered on AVT, so that there should not be any dearth in the manpower and the skilled professionals. And obviously, to support the post-rehab activities, I request all the ENT surgeons to depute your therapist or sponsor your therapist, or who are capable and who can do the PGDAVT program. So you can also support us by appointing qualified AVT therapist who has been trained from our institute or elsewhere. And my humble request is that every ENT surgeon should be a brand ambassador, and they should support the AVT program. When I talk about the ambassador, Jaspal, I thought of, Aksha. See, look at the Aksha. I had the opportunity to know about Akansha very recently, who is currently pursuing a course in fashion designing from the National Institute of Fashion Technology, which is a very lead institute in Mumbai. And she's a choreographer, and even she has her own personal YouTube channel. So to all the surgeons listening to me today, I would want to say that your endorsement for skilled professionals will help many young children to reach where Akansha is today. I would also take this opportunity to appreciate everyone's contribution, in making this cochlear implantation a reality even in the rural areas, and that too among the low socio-economic sections of the society.
Very valid suggestions, Dr. Matthew. Providing holistic support under one roof. As the number of cochlear implant surgeries increase, the focus on efforts for rehabilitation services must be taken simultaneously and seriously also. Well, we also have many government officials who support state and central CI programs. Many of them are here with us today. Is there anything you would want to convey to them?
Jaspal, I came to know that, there are several government officials as well as the State Commission of Disabilities, who are joining this webinar. And I just wanted to say to all of my colleagues that we, the government officials, are the policy makers of our country. Many states have introduced the cochlear implant programs, but do not have the required manpower to support the post-implant services, particularly the rehabilitation through AVT. So I request all the government officials to support, in starting the AVT training and the therapy centers, in their own places, on their respective states, and which will help, our young cochlear implant children in your particular state to, mainstream at the earliest, and, they should be able to lead a life like that, how we all are leading it. Until then, what you can do is that you can sponsor or depute, your state, some of the specialists, specialists in the field of rehab for this PGDAVT at MIG or any other centers, to get them, equipped with AVT, so that they can be the mentors, and they can lead your state, in training the other professionals too. And secondly, the universal neonatal hearing screening, that we say is UNHS, it's not only a reality, it's not a reality in many states. That's a sad part. And I'm sure that, Dr. Samir Bhargava webinar today. And Dr. Sami will agree with me that you, Kirtane, Navlake, and there were a good number of ENT surgeons, pediatricians, rehabilitation professionals are striving hard to bring this a reality in our country. So I think that we at the government level should support their request of making this universal hearing screening a reality for them. And another point I want to put forth at this juncture, Jasad, is that I request all the government officials to develop schemes for supporting the cochlear implant recipients. By providing incentives to those whose children are implanted below 2 years of age, support their speech processes, which are very costly and not affordable for a family. They can support cables, batteries, and other accessories, and even they can start with an insurance or a healthcare scheme for this children.
Dr. Suni, I must say your words are music to my ears. Early intervention is of course important, and CI children of course do need the right support system. Through surgeries, the recipients are introduced to a world of sound, but it is only with the right therapy and right coaching that these young kids can get completely integrated into society. And then they can grow up to become capable and contributing citizens of our country. This brings me to my next question, which most often I am asked. How do we ensure that CI recipients have better outcomes? What is your take on that?
Let me start by saying that,